Hello, counseling supervisors. So thank you for being willing to supervise one of our students from the Rehabilitation Counseling Mental Health Program at MSUB. I'm Dr. Aaron Murtis, and I want to, as quickly as I possibly can, describe the process of getting a student and what the paperwork stuff is all about, because we get lots of questions about this, and I thought maybe just explaining it might help. So the first thing, of course, is the student will come to you and ask you if you would be willing to be a supervisor. Probably already did that because that's why you're here. The next step is the student has to do some work on their end, and we're really leaving it up to them to help kind of navigate the process between you and I. I'm the clinical coordinator, by the way, so you might work with me before you get the student into a class, or they're in the class officially, and then work with a different faculty supervisor through the process. But I'll help with the initial stuff, or maybe you'll work with me because I teach a practicum class as well. So they'll have some additional things to guide you through what you need to accomplish. But they often don't know what the expectations from our end are, and we don't know what the expectations from your end are. So I will tell you that they have to apply for liability insurance, and that's their next step, something that they're worrying about. The next big thing that happens between all of us is that we fill out a contract, and the contract is technically a legal document, but it's also a really good time for us to understand what the different expectations are. And if you have any questions about any of this from the school's perspective, feel free to reach out to me and let me know. I'm happy to talk to you about it. Even though it's a place where we can write down in the case of potential conflict, or if a student isn't doing what they're supposed to be doing kind of thing, or if we as the school aren't holding our end of the bargain, or you as a site aren't doing yours, this is the place where we can have things written down. But more or less, it's really just a place for us to come to some understanding of this is what's going to be expected of me. The student will ask you to provide 1 hour a week of supervision. They'll ask you for a little paperwork up front just to verify that you're qualified to do what you do. It's for formality, more or less. And then they'll need to get a certain amount of hours over the course of the program, and especially exposure to clients directly. That's going to be the important stuff. Bunch more details. We don't need to worry about that right now explicitly. The big thing that I want to comment for you or tell you guys about is that we're going to ask for 3 pieces of documentation. Number 1 is a copy of your license. Many people have that already copied down, but we just need an electronic copy of that. Number 2, we need some sort of resume or CV or something like that. Basically what we're looking for is, do you have the credentials? Do you have an education that would lead you to be a supervisor, that kind of thing, or a counselor? So license, resume, or CV. And the last thing is the most confusing one, which is the proof of supervisory training. When you get out into, or when the student moves on from our program, if you're still their supervisor, the state will look at you and say, are you qualified to be a supervisor? Do you have, are you 3 years post-licensure? That's one of the requirements. Or have you taken the state's approved training to be a supervisor? We don't have that training requirement, or we don't have the same training for you that we offer. And we don't have that you have 3 years post-licensure, but what we do say is we need some kind of document to show that you know what it's like to be a supervisor of a counseling student, which is different than counseling itself. It's different than being a manager or a boss of a counselor. It's just something that our accreditation requires. So I'm going to show you really quick here an example of what we sometimes give out. I just went to a search engine and put in, and apparently misspelled, counseling supervision CEUs. And if you go in here, this is one that I sometimes pass out as an example. If you go in here and take one of these courses on counseling supervision, which are relatively low cost, and they count towards your continuing education for licensure renewal, if you do one of those, you'll get a certificate at the end, and that would count as your proof of supervisory training. I don't know the quality of these things, and so I'm even a little reluctant to recommend them because I just don't know if they're good or not. But what I will say is that there are long, like 20-hour training programs that you can go to about supervision, and they're excellent. I've heard really good things about the Bozeman counseling program. They have one that people talk really well about. But they're more time intensive, and they take time away from work, and they cost more too. So you can decide how you want to do that and what your own personal values are regarding supervision, but we just require something that says you have been trained. That's basically what that is. After that, there's a little bit of computer work, and the student will take care of the majority of that. The last thing that I will say, and I'll let you go, is we use a software program called Tavera. And so if you get a request from Tavera, you might want to check your spam folders or junk boxes if your student says that you should be getting something. But if you get a request from them, that is likely where you can sort of start a password, which you put in a password, you set up your account, and that's where the student will send you their hours to be signed at the end of the semester. We ask that you fill out an evaluation on the student, pretty standard kind of stuff. But that's the software program we use, and more programs are moving to some kind of management system like this. And so this is becoming more normal for us and for other programs that I've been talking to around the state. So hopefully that kind of cleans up a little bit about what this is supposed to look like and a little bit of the process. The last thing I'll tell you is that every site is unique, the kind of clients you see, the kind of services you provide. And so there's always going to be some quirky language. One of the big ones, I guess, is we, in our contract, we say the student should have exposure to people with disabilities. And one of the questions we often get is, well, we see clients with mental health conditions. That's not really a disability. And it's really just a lot of semantics. We consider people with mental health conditions or psychiatric disabilities to have some kind of functional limitation in your life. If you have depressive symptoms and you can't get out of bed, that means you can't function to like go to your job or bathe yourself. And so it's really just a lot of language. So likely the work that you're doing, if it's in a supportive, helping, counseling kind of role, likely it'll work for our program. But feel free to let the student know, let myself know if you have any reservations about that, if it seems to really fit what your understanding is of what a good counseling experience is, or just good practice. So anyway, more or less, hopefully this is helpful to understand some things, and it's an invitation to connect with myself or anybody else from the program that can answer some of your questions if you'd like some more clarification, because we certainly can do that. And thank you again for doing this for them, for us, and for the general well-being of the counseling community, I guess. That's why we do this. So talk to you later. Bye.